with Health Matters. And I'm talking from the subject Black medicine. Black medicine. Better put, where Blacks entered medicine historically. I gave a little excerpt, just a itsy bitsy excerpt about some of the things I'll be talking about. And you should have seen the vitriol that came my way, pulling the race card and all this other stuff, looking for an excuse. It just showed me how much ignorance is still out there and how people are perishing for lack of knowledge. And we've always been taught that if we don't know our history, that history is destined to repeat itself. These are some of the things that inspired me to, especially after some of the comments I saw, that, oh, yeah, you on a sweet spot right now. You need to go ahead and proceed. So I'm going to talk about this Black medicine, historical perspective. I'm also going to put you on some game on how we can overcome and go from exploitation of the past, experimentation of the past, to empowerment of the present. There are modalities out there that we can use for our benefit, our as in Black and brown people. And let me go ahead and throw poor white people in there. Now, why do I qualify it like that? Well, historically speaking, it didn't matter if you was wealthy or were affluent or famous in days of old. If you were Black, it didn't matter. Your pigmentation was your plight. And if you were white, if you made money, then you didn't fall into the dumpster bag of societal burdens like we were. That's the difference. What they called poor white trash, it was like, y'all can just put y'all dumbasses in there with the Black and brown. And that goes for exploitation, experimentation as well. So know that. So where do I want to start? Well, in 1808, the United States created a law to ban any further importation of slaves from Africa. Prior to that, there was 200 years of free movement of the influx of enslaved Africans to the Americas to build the America to what it was in that time, to be a plus to the industries that were created. Medicine or doctors didn't come into play until 1808, when no further importation could be done legally in the United States. So what happened was those slave owners, those plantations, they realized what they got is all they got. And the only way they're going to be able to stay ahead in this slave game is mass production. In other words, we can't import, but the women slaves, the female slaves, now became a hot commodity. Yes, as the supplies went down, their demand went up. In other words, they were forced to become baby meals, because that which came from the belly of a slave was yet still a slave. So with all these labors, with all these deliveries, the physicians of that time saw this being a lucrative field. So many of them aligned themselves with plantations, with plantation owners, especially for the purpose of maternal fetal medicine, knowing that there's profitability there. Unfortunately, medicine was still raw. And all they needed was permission or consent from the owner to experiment on these young Black women. And if they messed up on their cesarean section, they messed up. They'll get it right. If they created something called a obstetrics fistula, whereby you damage the vaginal wall using forceps or other means, And when that vaginal wall healed, it meshed either to the bladder or to the rectum, which means that fecal material now comes through the vagina, or urine comes through the vagina. A terrible situation. But there's one man, a Dr. Mims, that they coined the father of gynecology, because one 17-year-old that was impregnated had a baby. It was a problematic delivery. Forceps was used. She got a fistula. And as reported by in the notes of Dr. Mims himself and those in that era, he operated on this young woman some 40 times until he got it right. And then he was honored for a successful player, a successful surgeon on the role he played in successfully repairing an obstetrics fistula. A statue was made in his honor, actually. But what about the backs, the blood and guts of those used in this era to perfect medicine? Well, then came 1865, the Emancipation Proclamation, the abolishment of slavery. Well, that which was once a hot commodity and of value now became a burden, because we can't enslave them anymore. We can't use them anymore. We can't exploit them anymore. We cannot experiment on them anymore. So therefore, we won't help them anymore. And so now you have a people traumatized, undoubtedly, from the centuries of slavery before them, but now have to fend for themselves. So they created sterilization laws. First laws started cropping up in 1907. And with those laws, they were able to, if a person was deemed emotionally unstable, I bet a lot of them had post-traumatic stress syndrome, but if they were deemed emotionally unstable or feeble-minded or propensity of stealing or criminal activity, they were able to be locked up in the insane asylum. Now, what took place in these insane asylums was the mode of therapy for these Black and brown people that are now free people was what they call occupational therapy, which meant, yes, we can use them as slave labor. And oftentimes they would not get out until they have proved themselves of docile temperament. In other words, their spirit is broken and they'll be content to just being a worker the rest of their life. Many in the Black and brown community saw this and knew there was something they needed to do about it. And so Black physicians began coming to the forefront. 14 Black medical schools were created in the early 1900s. But what a daunting task when many of the hospitals were segregated. So that quickly dwindled down to about 7. Then in 1910, the American Medical Association saw this influx or potential influx of physicians that didn't look like them and had different backgrounds than them. And rather than see and have the foresight of perhaps this can bridge the gap of the trust issues that was caused by white America, they saw it as a threat of more physicians mean less money, more Black physicians meaning less money in their pocket. So they also saw that we can do this by developing a standard of medical education. So they created what was called the Flexner Report, funded by the Carnegie Foundation, a wealthy family in that era, just like there were other wealthy families. So by 1910, the Flexner Report came out, and things like adequate literature, adequate study environment, adequate hospitals, clean, sanitary, all these type of things were requirements in order for these medical schools to stay open. Well, by 1920s, only two were remaining: Howard University and Meharry. Retrospectively, they looked back and they saw that the potential of 30,000 African American physicians in the early 1900s was stifled from entering the professional market. That one act. So, with us being few and far between, is it just coincidence that now in the 1930s, 1940s, something called the Tuskegee experiment came out? And with that experiment, some 600 African American black men who had syphilis was told to come to this clinic sponsored by our very own federal government so that you can be treated for your syphilis. Now, in that day, syphilis was the one disease that affect almost every body system. And in the world of medicine, pathology is king. If you can understand the pathology, you can understand how to treat it. So we need to be able to observe a disease process from start to finish, and syphilis was that disease that affected nearly every body system, from the primary syphilis to secondary, all the way to tertiary syphilis with neurological problems. And while these people of color thought they were being treated, they were simply being observed for the advancement of medicine. Some 40 years of observation till it was put on Front Street, if you will, in the 1970s of what was going on. Now, can you imagine black households? Can you imagine in the 70s, husband, wife, 4 kids, and we get this information? And we also are familiar what happened with our grandparents in the earlier 1900s with exploitation and surgery, and many a times going through surgery without anesthesia because the medical community and scientists had deemed that Black Americans were impervious to pain. If they're yelling and screaming, it's only because they're being rebellious and don't want you cutting on them, even though Master Jones said it was okay. They're not screaming because they're in pain. They're screaming because they're being rebellious and we have to break them. So they had concluded in the medical community that we're impervious to pain. So can you imagine now you got a family in the 70s and you see these things going on? How many of you right now will be able to say, if you're 40s or 50s, how often did y'all go to the doctor? We all talk about, man, these kids today, they go to the doctor for anything. Well, for the African American, our issue was completely different. It was a trust thing, and rightly so, because it didn't stop there. No, it didn't. And finally, America began to have a conscience on this thing and understood that there's some apologies to be made. So in 2008, the American Medical Association wrote a formal policy apologizing for the Flexner report, realizing as crippled as the African American community already was, but yet striving and thriving in medicine, that something like standardization would cripple them and break them. And that's exactly what happened. 2008, they wrote a formal apology saying, I'm sorry. I wish they would have went further and incorporated the history of Blacks in medicine and made it a freshman curriculum in medical schools. Now, why am I saying that? Well, do I want credit? Do I feel like we need to be appreciated more? No, but I think it would create a level of empathy when a non-African American is dealing with their Black patient and why there seems to be such, quote unquote, a compliance issue with them doing what the doctor said. Because there's always in the back of the mind of, what is this medicine really doing to me? Or do I really need that surgery? Or do I really have cancer? Or does he just want to do an operation? Yeah. So it will help to understand the reasoning behind some of the logic that people of color may hold. So anyway, in 2008, that happened. Shortly after that, in 2018, the American Public Health Association had deemed racism as a public health crisis. In other words, there is a correlation in a person's color of their skin and health care disparity. Now, that's something we already knew, but we appreciate it now being a public issue. After that, in 2021, the WHO organization, World Health Organization, wanted to pay homage and honor to a young African American lady named Henrietta Lacks. In the 50s, she was found to have cervical cancer, and at the prestigious Johns Hopkins University, while doing a cervical exam, they took some of her cervical cells without her permission to do a study, and they found out that remarkably, she had a cell line that did not die. Yeah, the cells just kept on living, so much so that they called them immortal cells. And they gave them the name HeLa cells from her name, Henrietta Lacks HeLa cells. Now, why is that important? When you have a cell line like that, you can expose it to various disease processes, allow it to go on and grow, and find various ways of healing that disease. So out of this cell line came the polio vaccine. Out of this cell line came successful in vitro fertilization. Out of this cell line came various medicines for curing various cancers, chemotherapy agents. Out of this cell line came the medicines that we now use to pretty much eradicate or at least manage effectively the HIV virus. Millions have been made from this cell line. So the WHO in 2021 wanted to pay homage that this is what we did. We acknowledge it, and we want to honor you and your family for the advancement in medicine. Now, she died at 31 behind this, but thankfully, many years later, just recently, her family was gifted an unclosed amount for the service that she provided, unbeknownst to her, for the advancement of medicine. So, not just a historical thing in the 1900s. It seems to be entrenched now that if you want to learn some new medicine, find a black or brown person for which you can experiment on for the advancement of medicine. So then in 2022, the city of Philadelphia made a public apology for Dr. Albert Klingman's experiments on black inmates. They allowed him for 20 so years. He was a dermatologist, a well-known dermatologist who patented a retinoid A cream for healing facial blemishes. So he was already well known. Well, he was funded by various organizations, Johnson & Johnson's, U.S. Army, and others, to create treatments for various agents that may attack the skin. Well, in order to do that, he had to expose these agents to real skin. Guess whose skin? African American skin. Be it herpes, be it weaponry agents from Agent Orange, other radioactive agents, and he would expose them to them, let it do whatever it's going to do while he tried to create cures. Now, of course, this took place. It went on for some 20 or so years. And now in 2022, Philadelphia wants to apologize for it. So there is a history. There is a history that puts us in a situation where now we cut off our nose to spite our face. In other words, for the black and brown person, and yes, poor white people, because of these treatments of old, we are reluctant to see a doctor. We are reluctant to engage in healthcare. We are reluctant until it's almost too late. By the time we show up with whatever has been ailing us, we have end organ damage. Our heart is affected, or our lungs are affected, or our kidneys are infected, or our vascular system is affected, or our neurological system is infected or affected, and all of it could have been preventable. So, what I'd like to do going forward is provide some strategies to hopefully build the trust gap, provide a bridge so that we can close the health disparity gap. Not all of it now is on exploitation. Not all of it now is on experimentation, but much of it now is in our lack or our unwillingness to seek health professional, be it for a body problem or a mental problem, because historically, we've been taught from ages a sane asylum will lock you up. There's no getting out. We've been told for ages they don't really care about you. They're just giving you some medicine to experiment on. And there's ways that we can come out of this fear to now be empowered. There are ways that each and every one of us uh, can engage in and have access to. We have to lower the allopathic load on our lives. Allopathic load is the effect of chronic stressors on our emotional and physical well-being that they call allopathic load. And the higher that load, the more propensity for various disease processes coming your way that would not have otherwise had you not had to deal with this constant societal stressors. But you don't have to be a victim of that. You can come out from under that. And I'm going to show you how. Why am I motivated? Failure to know history, and history is destined to repeat itself. People die for lack of knowledge. I want to impart knowledge. There's a way you can, as black man, black woman, brown man, brown woman. We don't have to always have the shortest life expectancy. We don't always have to leave the world and those placed on dialysis. We don't always have to leave the world epidemic of obesity as the highest percentage rate. Over 50% of African Americans, brown and black people, are obese. Can we really blame anybody for that? Black man, black woman, black and brown people. We lead the world and those with renal failure needing to be placed on dialysis. Have we cut off our nose to spite our face? You listen, you stay with me, you follow along, and very concisely and precisely, I will bring us, you, me, others, health wise, from where we are to where we need to be. We are a resilient people. We are a people that's been through a lot and yet are survivors. So why are we the first to die? I mean, I'm going to plan on going into detail, educating the black and brown community to understand the health disparities and what we can do about it. Um, Taking ownership of our health, understanding that education and awareness uh, is key. And with that, we can take advantage of these new modalities in medicine, be it um, DIY medicine, do it yourself medicine. You can manage your own minor health care issues, and maintenance and preventive medicine runs supreme in this. We could talk about diet modifications as people, lifestyle modifications, and again, reducing that allostatic load in our lives. In other words, how to effectively manage stress so that stress isn't managing us. Um, all of these things we can talk about, regular health checkups, and then various monitoring health metrics. In other words, take advantage of the technology provided to us. And you can rise and be the cream of the crop when it comes to health and wellness. It's one thing to talk about it, it's another thing to be about it. And I want to talk about it and be about it. Um, and I want to do that with you, and we do it together as we have some uh, live podcasts coming up. I want to be able to answer your questions in real time for the time being. You can dial 888-530-6522 and leave a voicemail. It's my call-in number. And at times when we go live, that call-in number will be accessible for us to cue you in. If I'm not live and you ask a question, I'll respond to it online. I may ask you if you want to come on the podcast with me. Well, we're gonna get this thing. We're gonna get this thing right. Doing what I do and been doing it for 20 years, far too long. I've been having to go out in waiting areas, in family rooms, and sadly tell parents their 44-year-old, their 48-year-old didn't make it when I know they could have. Their 50, their 60-year-old didn't make it. I should not have had to have this conversation. And it's too late to have it after they're dead. All right? So I'm going to see you, or am I not going to see you?